Welcome, ladies and gentlemen. My name is V.W.P. Interested digit of my student ID 003, and we are from SCDP2. In this student project, Infection and Infectious Disease, we are going to talk about monkeypox. Next slide. These are SCDP2's group members. Next slide. Chapter 1, Introduction. Next slide.
Hi, my name is Skylenn Hertanto Tan with the last digit of my student number is 145, and today we will discuss about the introduction of the disease called monkeypox. So what is monkeypox? Monkeypox is an emerging infectious disease akin to smallpox and has gained attention due to its potential for human-to-human transmission. It is caused by the monkeypox virus and mainly seen in the Central and West Africa, but has sporadically occurred elsewhere. This virus poses a significant health threat, particularly in resource-limited areas, with the potential of larger outbreaks. This project explores monkeypox history, epidemiology, clinical manifestations, diagnosis, and prevention strategies, addressing its emergence in the early 21st century, its diverse genetic strains, and its transmission from animal to human or human to human contact. So, understanding monkeypox is crucial for public health efforts, contributing to effective disease control and safeguarding global health. That's all from me. The next slide will be explained by my friend. Thank you.
This is a list of problems in this student project. What is the etiology, epidemiology, pathophysiology, diagnosis and differential diagnosis, complications, and prognosis of monkeypox, and how to prevent and treat monkeypox.
Hello, my name
Next
is
slide.
Asweni Pururaswini Astawa and my last three-digit number is 161. The objective of this student project is to inform the definition and epidemiology of monkeypox, to explain the pathophysiology of monkeypox, to present the information about the diagnosis and differential diagnosis of monkeypox, to give information about the complication of monkeypox, to explain the prognosis of monkeypox, and to inform the prevention and treatments of monkeypox. So the benefits of this student project is this literature provides information regarding the definition, epidemiology, diagnosis, pathophysiology, prognosis, as well as prevention and treatment of monkeypox. We hope that through this literature, the public will gain further insight into monkeypox infectious disease. Also, we hope that this literature insight can encourage readers to be more aware of their environment and surroundings in order to prevent infection.
Chapter 2, Content. Next slide.
Hi, my name is Niputudia Urmila with last three digits of student ID 201, and now I'll explain the etiology of monkeypox. So, the orthopox genus and species monkeypox virus are all members of the Poxvididae family, which also includes the subfamily Cordofoxininae. Under an electron microscope, the monkeypox virus may be shown to be rather large, 200 until 250 nanometers. A zoonosis that spreads from animal to people is monkeypox. Rodents are the primary natural reservoirs. Mice, prairie dogs, head dogs, monkeys, primates, and pigs are assumed to be these animal reservoirs in areas of Africa. Direct transmissions between spillover hosts other than monkeys, such as human-to-human transfer, is the primary cause of the current pandemic. Monkeypox transmit via respiratory droplets, vomits, close contacts with lesions on infected people, body fluids such as urine, saliva, sperm, and feces, as well as swabs obtained from the oropharynx and rectum, have significant viral loads, implying that sexual transmission is a key contributor to transmission. Respiratory droplets can spread the virus if a person is close proximity within 6 feet to an infected person for a prolonged period of time, 3 hours or more. That's all I can explain about the etiology of monkeypox. Thank you.
Hello everyone, my name is Uttami Kanya Uttami and I'm student number 058, and today I'll explain to you a little bit of epidemiology of monkeypox disease. So basically the name monkeypox comes from the outbreak of vascular disease among captive monkeys brought from American Denmark laboratory in 1958. The monkeypox disease has become endemic in Central and West Africa and has been identified as a growing public health threat in Africa. Since the beginning of 2022, the spread of monkeypox virus has become more global. In May 2022, it has reported cases in non-endemic countries. Unlike West Africa, where the virus is prevalent, the majority of confirmed cases with travel history indicated travel to non-endemic countries, such as Europe and North America. In Indonesia, one positive case was discovered in a 27-year-old patient with prior overseas travel. As on October 2022, it has recorded around 76,871 monkeypox cases from more than 109 non-endemic countries. That's all for me. Thank you.
Hello everyone, my name is Amelia Sasikirana Dewi with last digit 207, and today I will explain about the pathophysiology of monkeypox. The invasion process of monkeypox includes entry, cell membrane fusion, and invasion. Monkeypox can enter the host body through various routes, such as the intradermal, oropharyngeal, and nasopharyngeal routes. Sexual transmission is also included among these routes. While envelope virions fuse with the plasma membrane at neutral pH, mature virions enter host cell via macronocytosis. Monkeypox can spread throughout the host after evading the host immune system. During primary viremia, the virus spreads to local lymph nodes, causing lymphadenopathy. Then monkeypox can spread to the circulation and infect other organs, causing the secondary viremia. That's all from me. Thank you.
Please let me introduce myself. My name is Julyvia Gifensius with the last three-digit registration number 088. I will now explain about the diagnosis of monkeypox. Close contact with infected animals, this is humans, or contaminated inanimate things may transmit the virus to humans. In humans, the incubation period typically varies from 7 to 14 days. Monkeypox symptoms include fever, headache, weariness, myalgia, broad body aches, lymph node enlargement, and skin lesions. It may be difficult to diagnose monkeypox only on the basis of clinical presentation. A PCR or polymerase chain reaction test can be conducted to determine if the patient carries the monkeypox virus. Assessment of the patient's travel history to places endemic with monkeypox is also important in diagnosing monkeypox. That's all from me. Thank you.
Hello everyone, my name is Julyvia Gifensius and the last three digits of my student ID number are 212. Today I will explain about the differential diagnosis of monkeypox. The first one is hand, foot, and mouth disease. So similar to hand, foot, and mouth disease, monkeypox frequently present clinically as influenza-like symptoms and a pustular rash. The most common symptoms include an illness that resembles the flu, mouth sores or pustules, and a palmar and plantar rash. Germany has over 3,500 cases, necessitating differential diagnosis and testing. And the second one is chickenpox or varicella, where chickenpox diagnosis is based on a recognizable rash and recurrent outbreaks of lesion with a history of contact during 2 to 21 days incubation period. Childhood cases typically start with an exanthum, while adults and teenagers may experience headache, nausea, myalgia, and anorexia. The illness typically lasts 4 to 5 days. That's all from me.
Hello, my name is Ana Agus Aguraneksuma and the last three digits of my student ID number is 181. I will explain about the complications of monkeypox. Monkeypox symptoms usually subside or disappear within a few weeks of supportive care. Although the disease can be severe in some cases, leading to complications or even death. Newborns, children, pregnant women, and other people with immune deficiencies are at a higher risk of developing severe symptoms of monkeypox. There are some possible complications that may occur based on some case reports that include secondary bacterial infection, encephalitis, myocarditis, pneumonia, and even conjunctivitis. That's all from me. Thank you.
Hi, now we are going to talk about the prevention of monkeypox. They're similar to many kinds of preventions from other infectious diseases, because monkeypox virus can spread from person to person through body fluids such as saliva, urine, feces, semen, and also skin-to-skin contact through rashes. People should first avoid direct and indirect contact physically or sexually with the infected person or a person who is at high risk of catching monkeypox. Second, people should avoid getting too close to infected animals, such as rodents and monkeys. Third, people should avoid going to endemic countries with monkeypox. Fourth, people should maintain good personal hygiene through washing their hands or through using antiseptics or through showering. Fifth, people should wear personal protective equipments, at least masks, because monkeypox can spread or transmit through droplet transmission. Six, people should educate and spread awareness about monkeypox and how to prevent it. Next slide. But how about vaccination? Can it be used as a means to prevent monkeypox? Yes, but it is not compulsory. But why? Smallpox and rubella has mass vaccination, but why not monkeypox? Well, the Ministry of Health of Indonesia state that mass vaccination is not required nor recommended for monkeypox because there are a limited supply of vaccines and the fact that monkeypox is a self-limited disease. And also, there is a small number of reported monkeypox cases with complications. Instead, vaccination can be used as a means for pre-exposure and post-exposure prophylaxis. The pre-exposure prophylaxis can be implemented to a person when that person is at high risk for exposure to the virus, such as immunocompromised, men who have sex with men, or lab personnel who will be in contact with infectious sample containing octopox virus. The post-exposure prophylaxis can be implemented to a person in the period up to 2 weeks after possible infections from any potential contact with the infected person. That's all from me. Next slide.
Hi everyone, my name is Ngurah Bagus Bhismaka Ariel Putra, and my last 3-digit numbers are 1 to 4. And now we will discuss about the treatment for monkeypox. So most monkeypox cases are usually self-limited and only present with mild symptoms. Therefore, there is seldom need for specific therapy and professional care. However, hospitalization, supportive and symptomatic therapy could be useful for some patients to manage pain and complication, prevent dehydration, relieve discomfort, and prevent long-term sequels. Monkeypox in more severe cases and special group, for example immunocompromised patients, pregnant women, and the pediatric age may require specific treatment due to the high mortality rate. As of right now, there is no drug specifically developed for monkeypox. However, several antiviral developed for smallpox, for example tecovirimat, brincidofovir, and cidofovir, are expected to show signs of efficacy in monkeypox treatment. Those drugs work in both diseases due to the genetic similarity in both of the orthopox viruses. We will discuss about the drug of choice in severe monkeypox treatment. First, we will discuss about tecovirimat. Tecovirimat, available in oral and intravenous form, is the drug of choice for most monkeypox cases. It has recently been approved by the European Medicine Agency for monkeypox treatment. Tecovirimat functions as a virustatic drug by inhibiting VP37 proteins, therefore blocking the formation and subsequent escape of envelope virions, resulting in drastically reduced virulence. Second, we will discuss about brincidofovir and cidofovir. Brincidofovir and cidofovir functions by inhibiting the viral DNA polymerase. Brincidofovir, a lipid conjugate, is converted into cidofovir intercellularly. Cidofovir is then converted into its active metabolite form, cidofovir diphosphate, which causes selective viral DNA synthesis inhibition, disrupting virus replication.
Hello doctor and my group mates. My name is Bernard Fatti, with the last 3 digits of my student number is 103. In this capture, I will talk about the prognosis of monkeypox disease. The prognosis of monkeypox disease can be highly variable because there are several or few factors that differentiate the prognosis. There is 8 factors, underlying health condition, and immune status. People with the problem with immune status, such as immunocompromised individual, like people with HIV/AIDS, lymphoma, or leukemia, is a higher risk to face the severe forms of monkeypox. Why? Because immunocompromised individuals, it has a limited immune response, limited ability to combat infections, high risk of complication, and won't heal
So,
each other. The prognosis for monkeypox depends on the person who is infected. If the person is healthy, does not have congenital disease or problem with their immune status, then the prognosis will be good. They may experience only mild symptoms or even no symptoms. But on the other hand, the symptoms they experience can be very severe if someone who is infected has problem with their immunity and then has a congenital disease and is also old. That person can get pneumonia, inflammation of the brain, and even death. That's all from me from the capture prognosis.
Chapter 3 Summary. Next slide.
My name is Dian and my last digit on my student ID is 070 and I will continue with the conclusion. Monkeypox is a zoonosis caused by monkeypox virus which belong to the genus of orthopox virus in the family of Poxviridae. Children are more likely to experience fatal occurrences of monkeypox and people between the ages of 40 and 50 seem to be more susceptible to this disease. Monkeypox virus transmitted by close contact from animal to human or human to human. The virus will spread in the respiratory mucus and oropharynx and enters the local lymph nodes or organs. Monkeypox symptoms include fever, headache, weariness, myalgia, broad body aches, lymph node enlargement, and skin lesions. So PCR test of skin lesion swab, the detection of IgM antibodies, a rise in IgG antibodies, and assessment of the patient's medical and travel history help in diagnosing monkeypox. The differential diagnoses of monkeypox are Ph.D. and chickenpox. To prevent this disease, people should avoid high-risk people, monkeys, and rodents that were infected. They also should get vaccination. Monkeypox is usually a self-limiting disease with mild symptoms, but tecovirimat is the drug of choice for most monkeypox cases. The next one is recommendation. So during the writing of the student project, an obstacle in searching for the most recent research to be used as reference was encountered. Therefore, the newest research about monkeypox is deemed necessary. That's all from me. Thank you.
This is a list of references that we have used in order to make this student project. Next slide. We have reached the end of our presentation. We hope that the viewers can gain a lot of new insight and knowledge about monkeypox and its content. Thank you for listening, and don't forget to subscribe and like the video.